Thank you for using that. So just bend one knee. Bend one knee. Now, you could do glute sets and quad sets at the same time, of course, but if she digs her heel into, and this is for the bed level exercise is perfect, right? Think about your hip patients. She squeezes glutes, I palpate, make sure she's doing it. Okay, so you can even give her a little tactile cue, push down, push down, push down, squeeze those glutes. I'm tactilely cueing her what I want, okay?
How about
if it was quads, I would say push down into my hand and then tense up this muscle, right? Contract this muscle. So both quad sets and glute sets there. Okay, go ahead.
You could do bilateral too, right, with this?
Uh-huh. I mean, could you do glute sets and sitting? Can you? Yeah. If I sit here and I push into the floor, am I engaging my glutes? I am.
In prone, contraction in
Prone, no, because prone, I mean, I have air. What am I going to block
But
me?
if only I do contraction in the glute.
Just a glute set in prone?
Yeah, it's isometric.
I mean, you could if somebody was stuck in prone. And they couldn't go any other way. I don't know, they had a burn on their back. I don't know. So you could do a muscle setting exercise in any direction, right? Okay.
All right, so moving on to against gravity. So this would be like a 2 minus. 2 minus. So we would support.
That's gravity minimized.
Gravity minimized.
That's what he meant.
Gravity minimized. And then this when we support here on the pelvis, the crest. We start in flexion, active assisted range of motion, and make sure your hand is not on the patella. It's over here, distal femur. So we pull it back. We start in flexion, pull all the way back. Active assisted range of motion. Now she is a 2, so she could do the motion. So I just support, start in flexion, so she's doing all the motion.
Yeah. Oh.
Gravity minimized.
Yeah.
Now we are adding some resistance. She's a 2+. So with my thumb here on the posterior distal femur, she's doing the action. And I'm applying some minimal resistance here. She goes all the way into extension.
Just like MMTs.
Gravity minimized. Okay. So now moving on to 3 minus. Active assist against gravity. She would be here. We want to make sure that for hip extensors, we want to make sure the knee is flexed.
And in line.
And lined, yeah, no abduction or adduction. So she needs some assistance, so I'll have her go ahead and start the motion, and I'll just help her half of the way up. That's 3 minus, active assisted range of motion against gravity. So now we're moving on to a 3. She could do the motion, so she would just go ahead and do the motion on her own. We just kind of watch out for those compensations, no abduction or adduction.
No rotation.
And no rotation.
Good. And
All
if she
right.
starts rotating, that means she went too far, right?
Yeah.
So you would
So that's
cue.
compensation. Yeah, give her a cue and say you don't need to go up that far.
You put your hand there.
Yeah.
Stop them from
Stop
going up
here.
so far. No,
Yeah,
here.
go here. Up
Stop at
here.
the level. So
Yeah.
come on up.
Come
I'm
on.
gonna stop right there. So just hold where I want her to stop because she was going too far and rotating.
Yep.
Good. Okay.
So now we're jumping up to a 3+. So we're gonna add some resistance. With resistance, we stabilize over here at the hip, and we add that resistance here at posterior distal femur. So we go ahead and ask the patient to go and do that motion,
Good.
adding that minimal resistance. Okay. So now we're moving on to constant weight. So we add the cuff weight here. Hold on, sorry.
And just when you guys put these on, you want it to be the weight on top.
Oh, okay.
So they
Yeah.
shouldn't be dragging it under. They should be pushing through it on top.
Yeah. So again, we always make sure the knee is flexed and ask the patient to, okay, move up to here. That's good. So that's constant. Knee bent. Okay. So now we're moving on to variable. Tie it up here to be.
Of course, this would be a lot looser. Don't suffocate the leg.
And then for the skin, let me get a towel.
Yeah, you put a towel.
Or a pad, yeah, because
You need a towel. I have it.
yeah. Yeah,
Pillowcase.
just to put a pad. Yeah, and then with the hairband,
Okay.
You want it
kind
flat.
of flatten it out.
But this is a,
Yeah, we have to, this is too
this
tight,
one's been abused.
so we
Too
would add.
tight, pad it. Pillowcases are perfect, because they're just a little bit of, but that's okay, you have just that,
Yeah.
so that's fine.
Hold on.
For now.
Okay.
But what we wanna see is it open wide, dispersed, not a tourniquet, and we wanna see a pillowcase. That's okay,
So I
because
can
we're
lift
trying to
it
work
in,
through.
so that you can see.
We gotta make sure her posture is good.
Yeah,
Yeah, her posture, come
Come
forward a little.
closer
Let's
to
get
the-
Yeah, stand up straight.
Yeah.
There you go. Okay, that's better.
Nice and slow. both
Nice and
hands.
slow and controlled, yes, yes. Okay, good. Could you do that in prone?
I would say so,
Mhm.
Yeah.
It'd be harder to get off the floor.
Oh, she can do it. Look at that. Woo! Easy
Yeah.
peasy.
And couldn't you hook the band around your shoe?
You could if you wanted to engage your hamstrings.
yeah.
So, I mean, you guys could decide what to do, but just know what muscles are working. Because if she puts it on her foot, her hamstrings have to hold her in knee flexion and then do extension.
Alright, so get that one.
That would be a little active insufficiency. That hamstring is, from here is like,
So now we're moving to closed chain. There's various sets of exercises you could do. She's gonna demonstrate we could do squats. We could do the lunges, right? Deadlifts.
deadlift, yep. Start out small though too, good, that's fine. Which leg is working? Her left.
Yeah.
Her
that one.
left, glute, and also quads. Her left is working, okay?
There's no like one is harder than the other. They're pretty much the same level, right?
Or-
Same, but you know,
Stay
I
right
just
here.
want you to make sure that you know the simple things. See this as a mini squat. I got a target, I'm safe. The very first thing I'm gonna do with my hip patient, because we all are able-bodied, so we're shooting right for the big exercises. But you can go here, and then you can go lower, you can have a chair, you
You can
can
do
go to the
that.
low plinth, okay? You can either use it as a squat target, or you could do sit to stand. That's functional. Functional. Write that down, right? Sit to stand. So you have levels, and even if you get here, you have something that goes up and down, right? So if I go down with it, I make it harder. So if I go, and we do this in rehab, because a lot of times we're working on, right, low-level patients. I have this is all I could do, this is all I could do, contact guard. Then I go lower, 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 progressing, because this is harder. Lower the surface, the harder it is. So essentially, and when we're targeting function to get to a level of a chair, I'm documenting how high my level surface is for that patient to work. Okay? All right, that's it.
And for
Oh my
close chain
goodness.
balance, yeah.
Oh.
Safety.
I'm like, what? Oh.
I just failed my comp.
I just felt my cup.
Safety.
You will be recupping in 2 days.
So we have the belt for sure.
For sure.
This makes you super proud.
There you go. Before the patient gets up, we have to guard, so posterior and lateral, so we have the patient come up, and then she'll go ahead and perform this. Yeah? Do we have to kind of accompany?
Yeah.
Yeah. Yeah, like that.
Yep, you're working with her.
Yeah.
You got a
201.
mini to